Good morning. My name's Annette Iglarsh, and I am a speaker for the Senior Medicare Patrol, or SMP. And our goal is to protect, detect, and report. And we're here to help you be your own best friend as far as making sure that we can reduce scams and frauds and people taking advantage. And there's no such thing of, it's not going to be me because I'm really smart and I know this and that. Everyone is exposed to it. And I mean everyone. Some of the phone calls I get from my own family members is pretty outrageous. They're embarrassed when they get scammed. But then they call me. But what I'd like to do today is go through a presentation, and we'll also be talking about this, which is the Healthcare Tracker. And it's relatively new, and it's going to be distributed. I think it's currently being distributed. And we'll go over those in a second, and I'll make sure you have one. Okay, so we've been around for quite a long time, 1997. And we are actually in 54 locations, in 54 states and territories. And there are things that go on nationally to keep us up to the same level of information. And Washington makes very good, takes very good steps on getting us all the information so we have the up-to-date information, which, like everything else, changes almost daily. So we do keep on top of it. As I said, we protect, detect, and report, or we reach, educate, and activate. And so we work with Medicare participants, and that is a large number of people here in Massachusetts, but it's a group of people, me, I'm also a recipient, that really need the extra assistance. When I had a question, I went to one of our sister organizations, SHINE, that deals mostly with the supplemental and Medicare A and B. So before I go on, I should stop and say fraud is when someone intentionally, knowingly, willingly makes a request of you to usually give them money for a service or a product that you either don't get or don't need. And there isn't anyone in our age group that hasn't been hit with phone call, ads on TV, things in the mail that are really tempting people. And it's very hard to look at a form or talk to somebody and recognize it immediately because they're so adept at hiding behind the words like Medicare or healthcare or something that you think, well, they sent this to me, I should read it, I should find out what's happening. So we lost, it depends who you talk to, but last time I looked, we lost 60 billion with a B to fraud and scams. That's 10% of the budget and for Medicare. And so it's very problematic because at one end you're worried about how long are my Medicare benefits going to last if we're in all this discussion about making sure that we could keep up with the changes in pricing and things like that, to, oh my gosh, 10% we just gave to somebody that's illegal. So that's an impetus for me to get started in something like this. Errors could be intentional or unintentional. How many of us have gotten on their keyboard and hit the wrong keystroke? Well, if somebody is recording your medical bill and about to send one out to you, all they have to do is accidentally hit another number and you'll be charged for something different. And so as a result, you may be charged for things that you didn't have, you didn't get, but Medicare will pay, and that's unfortunate. So we have to take the responsibility every month when you get, or every quarter, depending on which program you're in, you need to look at your bill It's confusing, but it's something that you really need to go through and identify, is this correct? Is it to the right person? Yes, they send the bills to the wrong people sometimes. Is it correct? Sometimes somebody keyed it in wrong. Sometimes you may have gone to somebody that took advantage of the program, and I'll talk about those. They're quite sneaky. But what you're doing is you're protecting yourself, and you're also protecting your neighbor. Because when I started this, and that's when I was a practitioner, I didn't even know that this occurred. And since I've been doing this, I told you what the figures are. Some people say it's up to 90 billion, but I use the lower number just because it sounds a little bit better. So you'll hear it between 60 and 90. There are six things that Medicare doesn't pay for. And that it's helpful for you to know that if a service isn't rendered, if they find out that somebody billed you and you didn't have the service, they won't pay for it. Now, sometimes they don't find out and they pay for it, to be truthful. But the thing is you're going to be held responsible because you were the patient. So it's important that you make sure that you're billed for the service that you received. If you need a drug diversion program, those programs are not covered by Medicare. A thing that people do is referred to in billing as upcoding or unbundling. Bundling is when there's a code that covers several procedures that are usually done together. And there's a price for it. Or if you didn't have all the things, they can bill you separately for each of the items, each of the services that you received. And so they're able to get more money in reimbursement than they're really supposed to get. And this can happen knowingly or unknowingly. And so I'll talk about some of the things that you could do so that you could make sure it happens, if it happens, that you identify it and can do something. False front offices, in some cities or towns, they have people that just rent an office space, a store, decorate it, and basically you think you're going to a doctor's office. And they will bill you for services from that office, even though you received no services. So it's, again, I'll say this over and over, it's hard to believe that this happens, but it does. Another thing that's a real problem is identity theft. And when they get your Medicare card, it used to have the same number. If somebody steals it or electronically steals it, it used to be the same number, Medicare and Social Security. But you remember about 2 years ago, they separated them and we all got two different numbers. And that's because they're trying to protect Social Security from Medicare fraud and to make sure that if they get one card, they don't have access to the other account. And so it's very important that you really don't carry the Medicare card unless you need it. And it's important that you keep it in a safe place. And what we think is a safe place may not be. There are now, come on in. There are certain equipment, there is certain equipment that people could use. If you have your wallet in your pocket, in your pants, they can scan it by walking by you. And so it's important that you have a way to protect cards that really need to be read. Credit cards and your Medicare card and your driver's license. Those are three very important categories. And so I'll give you these at the end of the talk so that you have the information. But
I'm sorry, is there something you can put the card inside of so they can't scan it?
Exactly.
That's
all it is. It's amazing. And I have a couple. So I advise people to use it. I use it. Just anything to make it more difficult for people to steal from my account.
My sister had that done.
Yes,
What happens?
it happens to everybody.
It was like inside her pocketbook. They don't have to take it out or nothing.
Nothing. They just walk by you. They don't have to bump into you. Just closely, be approximately in your vicinity. Okay. The other thing is concerns from COVID. And that's made it really difficult because everybody's scared. Everybody's doing the best they can. And people want to be tested. So we have stories upon stories of senior centers or senior apartments, dwellings, where a person was coming around in a white coat, they all have white coats, and asking you if you wanted to have a COVID test. Oh my gosh, somebody came to my apartment, my house, and giving me a COVID test. Well, not really. Usually those individuals are just having you sign some paperwork, and then they give you a test that's bogus, and you don't get the results because the test was bogus, but they're able to charge Medicare. So as a result, you both have lost out. You don't get the reading as to whether or not you've been infected with COVID, and money has been paid when services were not rendered. And so it's amazing. And what we feel is...
They're not making you pay for the test. They send it to Medicare to get money back.
Right.
Saying that they took a test and they really didn't.
Right. But the thing is that when I say that we pay for it, or you pay for it, it's because it comes out of the big account. Okay.
That would show up on your statement.
Yes, that's one of the reasons you can look at your statement. Some of it is so complicated, but it just takes time, and you need to really focus on it when you look at the bills. Okay, let's see. You may also be given incorrect medication that you don't need, lab tests that you don't need. I knew a client that every month when she went to the doctor did the full battery of tests, soup to nuts. Well, those tests don't need to be run on a monthly basis. It needs to be pinpointed to what your needs are. X-rays, sometimes it's on the wrong limb, sometimes it wasn't needed, and they'll get paid for it.
That could go too far, too. I mean, I've been going to my primary care person and everything else, and once Medicare started to pay for a physical once a year, now I needed a physical once a year. Before that, I never needed a physical even though I asked for one, because he wasn't sure he was going to get paid for Medicare. And I didn't, I felt that though he was only going through the actions like enough to justify the physical. I still didn't feel as though I had a physical.
Well, and that's very possible. I mean, we like to think the best of our practitioners, and for the most part, we are getting good care. But then there's people that take advantage of the system, and it's something that is pervasive. It's in all different forms of medical care, dental care, and sometimes the doctor has no idea. So one of the best things to do is to be able to call the physician's office and say, you think you've been billed for something that doesn't make any sense, and they direct you to the billing service, and then depending on your conversation with the billing people, the bill needs to be revised, and if you don't receive a revised bill, you have to call the doctor again. It takes some time, but it's worth it.
No. I did that one time with a process that I got, and it seemed like though it was way out of whack. And probably wasn't Medicare, it was the insurance. And they said, that's what they pay for. They're not pinpointing if it comes in under that thing, they pay that much for it, whether you got it or not. You know, they didn't seem to care. I know we made what's too long ago, but I said, this is way out of whack. I didn't get any of that. Well, that's the, you know, the insurance paid for it anyway. It wasn't Medicare, but it was.
And then what happens is the insurance companies look towards raising the cost of the insurance because they're paying out. It's the type of thing that there are many layers. You know, you have the person that's directly treating you, the person who's doing some of the treatments, the billing person, the person handling the financials. There are a number of different steps where people can make mistakes or take advantage. Okay. The other thing is durable medical equipment. And what happens there, and that would be wheelchairs, canes, braces, things like that, is that if you get a call from someone, this is an example, and they ask you how you are, they're always really nice on the phone. They ask you how you are, and they engage you in conversation, and they say, well, do you have any pains anywhere? And I don't know too many people our age that don't, somewhere, every day. So they'll say, oh, my neck hurts. So they'll say, we have a brace for that. Well, and as they reel you in, as they say, do you have pain anywhere else? And it's like, well, sometimes my low back. Well, then they're on a roll. Oh, we have a back split that helps. It's not the fact that they're going to send you the material, not only the fact that they're going to send you the material and you'll be billed for it, and Medicare hopefully won't pay for it, but they usually do. But every month they repeat that and send you more. And so basically what you have to do is you have to put an imaginary barrier so that, just as I say, don't talk to people that come to your door, don't pick up extra packages. If you look outside your door or you're outside the crack in the door and there are packages, come on in. Too late? Never too late. If you have packages that are being sent to you that contain braces that they charge you for every month, if you don't pick it up and you say return to sender, then you won't get charged. But how many times do we do that? We usually check to see what's in the box, but some people really are taken advantage of by having this be over-delegated or inappropriately sent to you. I don't know, have anybody here had that problem?
I'm sorry, I couldn't hear what you said.
Okay, did you ever see a commercial for bracing? For braces or back hair, or you speak to them on the phone and they end up giving you more than you need, and then it's hard to stop them from sending it to you? Okay. And that's a real common scam. And you know, the problem is you take something like wheelchairs. If you get a wheelchair, you could only get, most of the time, get only once in 5 years. And as a result, if you get a wheelchair and it's not measured for you and it's not the appropriate, doesn't have the appropriate adjustments to it, you won't get the one that you really want when you need it further down the road within the 5 years. Mm-hmm. And that could be really serious because wheelchairs are great assistive devices, but if used improperly, can also hurt you with chafing, or that the brake doesn't work, things like that. So you have to be careful that you don't accept a wheelchair unless you really need it, and then they should be measured. So that type of thing is really important to be aware of, and it catches you off balance. Have you ever been in a mall and you walk down the mall and these people are in the center of the aisle and they have all these wonderful back supports, heating products, things that'll just make you feel good. And it's very convincing, but that's how they reel you in, and you end up giving your approval to something that you really didn't want to. You were just being nice. So you have to be extremely aware. And this could be wheelchairs, oxygen, neck braces, they love neck braces, a support hose. It could be a walker. It can be something as simple as crutches. An individual I know that was very ill and was in hospice care, went into hospice care, and it was in her home. And so the pharmacy sent everything, a commode, crutches, a walker, a wheelchair. This person hadn't walked in months, was not able to handle herself walking independently. And so all of this was wasted, and you can't give it back because it's been accepted. So it's another incident of waste. The other area that they might take advantage of is home care. That I used to do home care. I was a physical therapist for 45 years. And it's very, very valuable. But a lot of companies that come in and they might want to have too much done to you so that they could bill more. Maybe it's billing by time, so they stay and talk to you for the period of time that they're there. But it's important that the in-home care is appropriate to what your ability is. How mobile are you? Do you have safe transportation? And what most people find is that they will be barraged by people trying to get them to take them in, to let them come in. And as a physical therapist, I used to go from house to house doing treatment, but it was always ordered by the doctor, and the treatment was done according to what the typical treatment for physical therapy should be. They sometimes accidentally, but could be on purpose, bill you for more services, more visits than they actually did. And you'll be able to see that on your monthly bill. The other thing is that there's a difference between skilled services or unnecessary services. And so when somebody says, well, I'm picking something as an example. I could do a massage on your upper back while I'm here to treat your knee. They don't have a script to cover your upper back. So yes, it feels wonderful. And yes, most of us won't turn it away, but you only get the care, or you should get the care, that is warranted, and that is the only care that should be paid.
So how you do that, if you got more than one area that has to be treated, you should make sure that they're all on a script, or can the doctor give a wider spectrum of what to be treated?
Both. You have to see what the doctor had ordered, and very often, especially with physical therapy that has been evolving over the last century, that very often PTs get treat appropriately, or this is the diagnosis, treat the patient. But people do take advantage of that. And sometimes it's intentional, and sometimes it's not. And the only one that could protect you is you. And so we have to be more alert than you would like to be, and take, to really think about what services are rendered for you. And remember, when they say, oh, you don't pay for it, it's okay, Medicare will pay, we all pay. If somebody calls you and starts out with the spiel that I just said about, oh, do you have any neck pain? Or, you know, I'm sent by Medicare. They didn't say who Medicare, what Medicare, to talk to you about your health plan. It looks like you should really revise it. And they could talk you through a whole stream of things that will be costly, not necessarily give you good care. The doctor's office will not call you and ask you this. And a licensed person will not do that. A licensed person won't come to your door in a white coat either, if you haven't asked them to. So these are things you have to be aware of. Hanging up is not rude when you think it's a scammer. In fact, some people don't even answer their phones if they don't see the numbers. I think a lot of people have phone recognition on their TV or on the actual telephone. And if you don't get the number, they'll call back. Or they'll text you and say, I'm really trying to get in touch with you and you're not answering my call. And when I say they, the person that really should have been getting in touch with you, your family members. So that's one thing. Oh, the other thing, and this goes way back in time, but when we all had party lines, or we couldn't afford the phone, and so it was really a luxury, and we had to curb our phone use. And I grew up in New York City, and so you pick up the phone, you get charged for the call.
Oh, you're older than you look.
I work on it. But we're all in the same boat. And so what happens is, what we used to do is, we used to say, give me a ring and hang up, and then I'll call you back. And that way we knew that we weren't wasting the phone call or the time. So I don't know if any of you have had that experience, but it could work in these situations too. Tell your family members, give me a ring, I'll call you back, or give me a ring and you could call me back.
Still do.
Yeah, it's the fact that we're having this conversation is unfortunate, but it's reality. And it's important that we do what we can.
I don't know if what happened to me was a scam or not, but I was filling out the form to get the flu shot at one time. And there was a question on there that I didn't really understand what they wanted me to say or what they were asking. And I checked off something that had to do with Medicare. And after that, I would, for about months, I kept getting a call from some kind of a Medicare plan, because I indicated to them that I was interested in signing up for it. And I never responded to their question, but it went on for a long time.
Like I said, we all get stuck. And sometimes you're going through a form. It's also important for you to check who's sent you the form. How honest is the form? As soon as they get your information, they don't really need you for anything else if it's a scam. They just wreak havoc with whatever they can get into your personal accounts. But that happens. So it's important to really read it. And also, if you didn't ask for it, it probably, most probably, didn't come from your doctor.
No, I think I had asked for this, but I didn't understand the question, what they were looking for, and I evidently answered it wrong.
And that is really common. It really is. So that happens as well. Let's see, I'm just going to go down my list. It's important that you carry your Medicare card when you go to the doctor or a medical professional that needs to have the information from your card. It's important that you keep visual contact with your card, that you know that you're giving it to the person's writing something down, and then the person's giving it back to you. Remember I said about the false front offices? Typically they ask for the card, they Xerox it, and it doesn't go into their system. Well, it goes into their system, which is not an honest system, not into your medical record, which is what it's supposed to do. So it's important that you don't you need to protect your medical card, Medicaid, Mass Health, Social Security card, and all your credit cards. And we have to treat them like they're as valuable as they are.
I didn't hear that.
You have to treat credit cards
No. You said you have to treat them.
very safely. You know, think of them as money. and how we hope we're all more careful with money, but the cards, it's just a plastic card. And so we tend to demean what they stand for, and they really could wreak havoc with your bank account if they have your cards. So, so that's really important. Oh, if you go to a doctor's office and the person says, could I have your card? I just need to make a copy of it. That's legit. Keep your eye on your card. See where they go with your card. Do they go in another room? Or do they just turn around and put it in the machine and make a copy of it? You want to make sure that there isn't a third party that's going to get your number. So you want to keep track of your cards. And it's hard. It's you know, something that's not familiar to us that we have to do that. But you know, basically I tell the women to stand aside. I need to watch you copy that card. Okay.
But if there's somebody in the office that isn't honest, who has a boyfriend, couldn't they get your number no matter how well you keep an eye on it?
Mm-hmm. They can. That's the whole thing, is as good as you are and can save so much, they're still coming up with ways. And we're really lucky. We're in Massachusetts. Moira Healy is so wonderful, and I'm not doing this for political reasons, it's not an ad, but she has created networks and brought different states together from Maine to Florida so that they can find out where somebody's doing a scam in one area and someone else knows about it. Well, first of all, it might not be coming from the United States when you get called. And second of all, might not be in your own state. And so when they have more of a handle as to what's happening in a larger area, they're able to go after these people. And her groups have been so successful. And people have been penalized, jailed, or had to give up money, return the money. So she has really initiated some things, and hopefully they'll continue. And there are some other attorney generals from other states that are wonderful. But we happen to live in Massachusetts, so I know about her.
I guess everything happens to me, but I had a problem with a medicine. And I was trying to let the pharmaceutical company know that I had a problem with it. And I was talking with a guy, I think he from India, because that's where the pharmaceutical was from.
Mm-hmm. And that may be.
And it was probably legitimate, but when they wanted me to call back on a toll-free number, and that just seemed like a red flag to me, that I wasn't going to call anybody on a toll-free number.
Mm-hmm.
It didn't feel good. So I kind of like stopped my inquiry at that point, because I instigated the call, got the number from my pharmacy, from my local pharmacy, how to get a hold of the pharmacy. And so it seemed as though it was like legitimate, but when they asked for my toll-free number, it seemed as though that I didn't want to get it to them. I didn't want to call up on a toll-free number, because I heard one time you call up on this number and then your call goes
into the dark web and gets shared and sold and everything else. But you know, you were doing what the pharmacy said, so chances are it was more likely that it was a good number. But you didn't feel comfortable. You didn't follow through. That's appropriate. You go back to your pharmacy and say, I wasn't able to make a connection because I didn't feel comfortable on the phone giving them my information. You know, all they can do is say, really, come on, you got to trust people.
No, not today, I don't think.
No, not at all. Okay, so did you get these?
Oh, I did, yeah. Let me go grab them.
Okay. These are healthcare trackers, and healthcare trackers are something to keep everything together. Do you ever go to the doctor and you go, and they tell you more and more, How many of you write something down? If you write it down, how many of you know where you wrote it down? I mean, it's always on the back of something, on a slip of paper, and it's hard for you to get the information. And you are so certain that you're going to remember it. Well, I have problems with that. I don't. And so you have to have a place to put your medical information, small enough to take with you when you go to the doctor, that has all the information that the doctor's going to want to talk about or to hear about from you. So this is a booklet that has information about Senior Medicare Patrol and Medicare, but then it's followed by open spaces where you could write down that you have a doctor's appointment, when and where. You could write down what questions you have. You could write down what the findings are for your different blood tests or tests specific to your health status. And if you know where it is, you'll know that you have to take it with you, and you're able to sit at the doctor's office, and it'll be a much easier visit because you know what they said to you on your last visit, and you know what you want to say to them on this visit. So it's important that you have this, and you'll be getting copies of this, okay?
I know my dentist, I go in with examination and everything, and he wants some work done, and he said, well, we'll go do this, that, and the other thing. And we get some kind of agreement, and then when I go back for the treatment, I don't know when.
You don't remember?
He doesn't write it down probably. He doesn't remember, and I don't get the treatment that we agreed on.
Well, I had a situation where I went to a periodontist, and I had been to him before for a few years, I think. And I'm sitting in the chair, and they did the examination, and the doctor's behind me talking to his assistant and saying, write down that she needs a new cap, and she needs this tooth replaced, and had a number of things. They never talked to me. That was the last time I went to that dentist, because I have to be included, because there'll be things that I don't want to do. I want to delay. Maybe instead of taking 2 new drugs at a time, I want to take 1 drug, see how my body responds to it, and then take the other drug and work that in. But you should be able to use your common sense as to what's not feeling right. One of my friends used to use a line, spidey sense. Remember Spider-Man, spidey sense? It was like this special sense that he had that something wasn't quite right. And we all have it. We don't call it spidey sense, but there are times, like when you were on the phone, that you know that something's not right here. So, so it's important that you stay up on that. Okay. And there we go. For some reason, this is not responding. Okay. Just want to go and make sure I've done everything, or up to this point done everything. Home health fraud, I touched on it, but home health care, people can abuse home health care. And that is, they'll treat the patient as long as they're paid, not necessarily what you need. And so they've been clamping down on these services, and it's getting better, but it's amazing. When I used to do home health, I always had to be the one to stop the treatment because it exceeded, in some cases, what they needed. And sometimes it's really valuable, and you do need it. But unfortunately, some people take advantage of it.
Is there any simple way to find out what you're eligible for as regards home health care?
Well, you can look at your Medicare statements, and they give you those 2 books, 2 pamphlets, more like books, that have what is going to be covered and what's not going to be covered. The other thing is that you could look online on the Medicare Medicare site, or the other thing is that you could call them. Call them may sound like, oh my gosh, I'm going to call them? Usually people call their insurance companies that's in charge of their second insurance, but if not, you could also call Medicare. And what they do is they'll say the wait time is too long. When would you like to be called back? And they do. and it's a phone call, and the person's not rushed, and they answer your questions. It's always so amazing when it happens. But, you know, they answer your questions. I find that it's easier sometimes to get information from your private insurance company that may be overseeing your Medicare, that everything was kind of thrown together. But you need to be able to get in touch with people and just ask. And these people are there just to answer your questions.
I have a question. Medicare is my primary. And I always hear, well, if the Medicare isn't going to approve of this treatment or whatever it is, that your own private insurance won't cover it. And if I don't know, if I had stuff that was being covered before I had welfare for my primary, I kind of think that should be covered even afterwards. Now that it's my secondary, is that any kind of correct information? If Medicare doesn't cover it, my primary won't, even though they covered it before?
Depends who you're talking to. If you talk to Medicare, they may not have a good idea of what program you're on. So what they're saying to you might be something they think is correct. If you speak to your insurance company, whether it be the state or the Blues or whatever, they should be able to tell you if it's covered. And they should have people online that you're able to communicate with online or to talk to on the phone.
Well, one of the things that comes to mind is on my primary, well, on my insurance that I had before Medicare, I didn't have to go to a primary care doctor for treatment. But I feel as though now I have to. Even though my other insurance doesn't say I don't need a primary care.
Each insurance company has its own rules, and the rules are different for each one of their plans. So while you might not have needed to have a physical every year with one plan, you could be, say, in the Blues, Blues of Massachusetts. It's just that now you have Medicare. It may be that something is or is not covered. You know, like a preliminary visit. Okay? So just because you had it before and it's the same company doesn't mean they have to do it. If you're in have a Medicare, an insurance plan outside of Medicare, you have certain things will be paid. And if you switch to another plan within the same insurance company, it may or may not be covered. You have to be careful. You have to ask.
I had one doctor that I was pretty sure my secondary insurance could pay for. And the doctor wasn't going to accept it. But I couldn't get a refusal for my primary care, which was Medicare, saying that they denied that treatment. So that I couldn't go to I had to get a refusal from Medicare before I could go on my other insurance.
That must be a rule set up by your other insurance.
And I was wondering why I couldn't get a refusal from the doctor.
From the
Not to treat that, refusal for treatment because I wasn't covered. Then I could send it to my other insurance, but I couldn't get that from the Medicare.
What most people do is they submit, and when it's denied, they resubmit it to the other insurance company.
Yeah, but I couldn't get a denial.
But without a denial, they'll come back and they'll deny it. Okay, and then you'll be able to go to the other part of your insurance, your state insurance. And so it means more effort on your part, but never say never. Keep following up on it. I remember I once had an ambulance bill for over $1,000. As soon as I crossed all my T's and dotted my I's and spoke to all my payers, I paid only $100. That's how much of a difference it can make, just to follow up on it. And there are times when I ask somebody, I ask the physician, is this necessary? Like I had previously spoke about. And if it is necessary, it should be medically necessary if the doctor's ordering it. Okay? Okay, so you're going to keep the information about your drugs, if you've had a medical incident, a change in your Medicare status, your health status rather, in this booklet, and this is what should be coming with you. And some people say, oh, I need more than that, so they bring another pad, but some people never do. They're always writing on the back of an envelope that they'll eventually throw out before they need it. Okay, so this should help. And this I'm going to give out. Please take at least 2. You want to pass this behind?
Thank you.
And I'm going to leave the rest of these with Alicia.
Just a point of information. If you have in your wallet 2 cards that have the scanning thing and they're close together, they can't.
Really? See, now I haven't heard that, so I really appreciate you saying
won't tell
something.
you that. No one will tell you that.
So what happens if it's in a wallet that is protected and they're all together?
Depends on how close they are to each other. They can't read them.
Whoop. Just a point of
I would have
information.
got that for you, but then you would have helped me up.
I was lucky that you didn't have to help me out. I was careful. You ever seen a wallet like this?
Yes.
And so you're saying that if the cards are touching, it won't help?
That's right.
Huh. Well, beware.
It kind of makes sense that it might confuse the,
It scrambles them.
And that's all it does? It doesn't block them, it scrambles them, and that may be enough, or it's not enough? Huh. You do learn things every day from people that you'd never think
probably
of.
confuses the scanner. Don't know what card it's reading.
Could. Anything that would help from your cards to being stolen is important. Are there any questions or any issues? Yes.
This is going off the subject a little bit, but just on Medicare, they don't pay for health clubs or anything like that.
Usually not.
Usually not. Only the Medicare
Supplemental.
supplement, they pay for it, but not the Medicare. So
Yeah. And sometimes, you know, you could belong to an organization that will do that to help you. I don't know what AARP does, but they're likely to have something like that to at least help you get in to a health club, find out what you need and what they can do to help you. Any other questions? Go for it.
If I get a treatment or an analysis or a prescription required from the VA when I go down there, and if I get a prescription from the VA and they charge me for it, and then I tried to go to Medicare to get them to pay for it, they will not. Why?
They should. I have not heard that before, because people treat their VA physicians and practitioners as you would outside of the VA. That's interesting. Have you had medications covered before? Huh, I'm going to look that up. But it's,
I followed it as far as I could without getting disgusted and upset, and just let it go.
well, one of the things that comes on this is something very valuable. It's a phone number to the people that I represent, to the office. And they have people that review cases and will see if they can improve your situation and help you get reimbursed. Sometimes it's that you were billed and you were the wrong person, and when you try to get the insurance company to help you separate things, it's very difficult. Or you're in a situation where somebody is taking care of you because at that time you're not able to ask for what you need and want, and they won't talk to someone that hasn't been designated by you earlier. So what you need to do is you call, and it's an 800 number, and there's, most of the time there's a live person there, and they will write down the information, and they will keep you apprised as to what they're able to do and what they're finding out. And we've been really fortunate. We have an unbelievable group of people, many of them volunteers, who will do this to help people be treated right and get the best type of medical care that they need. But yeah, and my husband's a veteran too, and I should know about those things. Wow, I'm surprised. I'm going to find out. I will send it to Alicia. Okay, whatever I find out. Any other questions? Ladies, you don't have any questions?
Thank you.
You're welcome. This is part of what my retirement is I do this to help my peers, you. So I thank you for coming in and for listening, and make sure you stop at the table as you walk out, because we have all those things that you need, and Alicia's laid things out for you. And if you have any questions, the phone numbers are all in here, and people will help you. And respect you. And I think we all know how important that is. But they're really quality individuals that will do the best they can to help you get the right service, or get you in touch with someone that could get you the right service. Okay? Thank you. I appreciate it.